Well, welcome to the Illinois SNAP-Ed Impacts webinar. I'm Jennifer McCaffrey. I'm the Assistant Dean for Family Consumer Sciences at the University of Illinois Extension. And thank you for taking your time out of your busy schedules to join us to hear a little bit more about SNAP-Ed and what we're doing in Illinois. SNAP-Ed has been in existence for 30 years and has evolved from not only impacting individuals, but also organizations, systems, policies, and communities that aim to address nutrition security for those who face socioeconomic hardships. This past year, we took a deeper look at Illinois SNAP-Ed programming, and we are thrilled to share that for every dollar spent on Illinois SNAP-Ed, the program returns up to $9.54 in future benefits. So as you can imagine, we are very excited to have a program that has these type of impacts. And over the next hour, we're going to share some background on what SNAP-Ed does in Illinois and the results of our deeper evaluation that we have conducted over the past 3 years. We will have time for questions, and so we ask that you put your questions in the Q&A section down in Zoom. So if you look along the toolbar at the bottom of your screen, there should be a Q&A box, and you can feel free to put your questions in at any time, and we will be answering the questions at the end. Let me introduce our speakers who will be taking you through our time together. Up first will be Trinity Allison. She is our Senior Program Lead for SNAP-Ed at the University of Illinois Extension, and she will be providing background on current SNAP-Ed programming in Illinois. She will be followed by Carrie Vasold, Brenda Wolford, and Corey Ryan, who are our consultants with Alterum, who assisted us on the deeper evaluation that we conducted over the past 3 years. So they will be taking you through our evaluation results. And then lastly, Melanie Kluzak from Illinois Department of Human Services, who oversees the SNAP-Ed program at the state level for Illinois, will be talking about some next steps in terms of SNAP-Ed programming in the next 3 years. So I will turn it over to Trinity to get us started.
Thank you, Jennifer. On behalf of Illinois SNAP Education Programs, we are so excited to have you with us here today, and I am grateful to be able to share more about who we are, what we do, and the impacts in our communities throughout Illinois. So I'm going to start with at the top with an overview of SNAP-Ed programming in Illinois. So SNAP-Ed is a federal program administered through USDA. Like the SNAP, the Supplemental Nutrition Assistance Program, which provides monetary benefits to purchase food, SNAP Education is also part of the Farm Bill. Those USDA funds flow through the Illinois Department of Human Services, who acts as the state agency in administering the funds, providing administrative oversight and coordination of planning. IDHS then contracts with the University of Illinois to provide SNAP education throughout the state. And so SNAP-Ed in Illinois is implemented through the University of Illinois under the brand of Eat, Move, Save. Because we are a very large state, the program is carried out by 2 University of Illinois organizations. University of Illinois Chicago's Partnership for Health Promotion, or CPHP, covers the city of Chicago, and then University of Illinois Extension covers the remainder of the state, including Cook County. To give you an idea of the scope of our program, last year we provided SNAP-Ed programming in 100 counties, serving over 500 communities. Our direct nutrition education programs reached over 55,000 individuals. As you'll hear more in just a bit, we also often see the people who participate in our programs multiple times. And so when you look at our total numbers, over the course of over 14,000 classes, that number grows to just over 242,000 contacts. And that's just from our nutrition education classes, which provide hands-on skills and opportunities to try new foods and share ideas with people living similar experiences. We also work with partners, like many of you on the call today, to help put in place systems and strategies that support healthy eating and active living. And so this aspect of SNAP-Ed, when combined with the reach of our social marketing program, reached over 4.5 million Illinois residents last year alone. So I would like to take a moment to say, for all of our current partners on the call, thank you for being one of the over 1,300 organizations that we worked with in the past year. So to pull us back just a little bit, the goal of SNAP-Ed nationally, as I said, we are a nationally funded program, is to improve the likelihood that people eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans. And so how we do this in Illinois specifically is working around 3 major strategies that help expand the SNAP-eligible population's ability to eat nutrient-dense food and be more physically active. And so that includes improving diet quality and physical activity levels, increasing food access, and then working collaboratively with community members and organizations to increase our effectiveness and impacts in those 2 areas. And then across all of our work, we seek to prioritize equitable approaches by engaging and working alongside our neighbors and our friends to build communities that support healthy eating and active living in ways that are authentic and relevant. This includes multi-layered strategies that focus not only on the individual, but also the organizations they interact with and the broader communities in which they live. And so what we do is structured around the social ecological model, which is just a fancy way of illustrating how we work at all of those different layers that impact individuals, because we know that just providing nutrition education alone isn't enough to change behaviors, especially when people don't have access to the foods that they need or safe places to play in regards to physical activity. Conversely, we can change systems to, say, increase food access, but if families don't have the knowledge and skills needed to cook and prepare those foods, or the foods aren't familiar to them, it doesn't have the level of impact that we're striving for. And so Illinois SNAP-Ed provides 3 different layers of programming: direct education at that individual level, healthy messaging campaigns that influence those social interpersonal networks and community norms, and our work on policies and systems that seek to improve the environments of organizations and the broader community. And so I know many of us on the call probably have a general idea of what it means to eat healthy. I'm a registered dietitian. I know what it means to eat healthy, but it did not stop me from stress eating a giant muffin for breakfast this morning. Our food choices and our physical activity choices are complicated. And so our approaches in trying to improve population level diet quality and physical activity have to be collaborative and layered. And so for this reason, we take a community network approach, which really just means that we, our SNAP-Ed team members who are living in and being present in the communities that we serve, have a deep understanding of where our SNAP eligible families go to eat, learn, live, play, shop, and work, where they go about their daily lives. And then we seek to partner with those organizations, all the ones that are listed here, to provide those different layers, those 3 different layers of programming at as many touch points as possible. So we bring our program opportunities to the people and not the other way around. And a key piece of this is that our approach is driven by the community, their wants and needs, their unique assets and barriers. This is not a one-size-fits-all approach. We have a huge toolbox in SNAP-Ed of strategies and services, and we work alongside our community members and community leaders to provide the options that are right for them. And so now that you have an idea of how and where we're using those strategies, I'm going to take just a few minutes to share more about the 3 different layers of our programming. And so our first is that individual level education that we do with adults, children, and families together. It's what SNAP-Ed has been historically known for. And all of our materials are evidence-based and include behavior change strategies that focus on healthy eating, moving more, and saving money. And so this includes a lot of hands-on experiences for the groups that we work with as we try to incorporate cooking skills and tasting experience as often as possible, as well as opportunities for participants to share their stories with each other. Another key component of our program that has great potential in reaching all of those different touch points along a family's network is our social marketing campaign. And social marketing campaigns use the same technology and planning used by commercial marketers. So these strategies help to adjust social norms by acting as reminders and prompts for healthy lifestyles. The same way seeing advertisements when you're out of home or on social media may prompt you to do other things like, say, buy a cheeseburger. And our social marketing campaign utilizes a lot of different assets. So we have advertising on social media, billboards, placements on public transit systems and bus stops, and then advertising on streaming media services. We provide partners with waiting room videos, posters, and other items to promote Eat, Move, Save strategies in the spaces that families interact with. We also send social marketing mailers with healthy eating and active living tips and resources to all SNAP receiving households in the state, which is over 900,000 households each quarter. And then the third major component of our program is the work that we do around influencing policy systems and environments of organizations in the broader community. So this is done through collaborative partnerships to assess the needs, gain community input, and develop action plans. So our SNAP-Ed team provides training and technical assistance for agency and organizational staff on strategies that help create systems and environments that promote health. There are a lot of things that SNAP-Ed cannot pay for, and so we also provide grant writing support to our partners to improve access to things like infrastructure for things like shelving and refrigeration units. We also help facilitate the writing of organizational nutrition and physical activity policies, such as those that are used within the charitable food system, schools, and community agencies. Another key component of this work is our participation in leadership within local, regional, and state coalitions, where SNAP-Ed acts as a connector between those various food system and active living partners so that we can use collective strategies for maximum change. And so now that we have this 40,000-foot view of SNAP-Ed and the work we do in communities, I'm going to take a few minutes to put you into the shoes of one of our participants and their perspective. The character is fictional, but the examples are real. And so this is Sonia. Sonia lives with her 2 children, ages 8 and 13. She works 2 part-time jobs, but has struggled in the past to keep up with day-to-day expenses. Knowingly and unknowingly, she interacts with SNAP-Ed throughout her day, helping her family to eat healthier, be more active, and save money. So we're going to learn a little bit more about Sonia. This week, she had a doctor's appointment. The Federally Qualified Health Center recently partnered with Illinois SNAP-Ed to start using the Hunger Vital Signs, a food insecurity screening tool, as part of the clinic's regular procedures. During this visit, the screening tool helped the clinic identify Sonia as food insecure, and as a result, gave her a produce prescription. Sonia was able to take this produce prescription to the on-site donation garden. This garden, funded in part with SNAP education dollars, provides nutrition education and opportunities to learn more about the health benefits of gardening. At the garden, Sonia talked to a SNAP-Ed team member about ideas for encouraging her picky eating children to eat more veggies, and scanned a SNAP-Ed QR code that took her to recipes of veggies from her produce prescription. The SNAP-Ed team member also invited her to attend a family event at the garden and an upcoming cooking school that SNAP-Ed was hosting not far from where she lives. She leaves the doctor's visit and the garden feeling optimistic about being able to provide her family with meals that they will all enjoy. At the bus stop on the way home, Sonia sees a poster for Find Food Illinois, the community food resource map developed by Illinois SNAP-Ed. She uses her phone to explore the map and sees there's a corner store near her home that now accepts SNAP benefits. This gives her an additional spot to buy groceries that is even closer to home and already on her bus route. During the rest of her bus ride, she scrolls her social media account where she sees a sponsored advertisement for Eat, Move, Save about how to plan meals from your pantry to help save money. One of her friends had just been talking about this, doing something like this, and so she clicks on the link to find out more. While on the Eat, Move, Save website, Sonia finds videos on how to prepare meal kit recipes that she can purchase online using SNAP benefits, as well as information on how to store produce so it doesn't go to waste. Before heading home, Sonia stops by the food pantry. Sonia has always struggled with needing to visit the food pantry because she works so hard at those 2 different jobs just to make ends meet, but she appreciates how friendly and helpful the pantry staff and volunteers are each time. Little does she know that this pantry is part of the regional SNAP-Ed Pantry Network, where the pantry manager receives regular information from SNAP-Ed on how to address nutrition security in the community. With the help of SNAP-Ed, the pantry recently switched to a shopping style layout and implemented a nutrition policy, resulting in food drives, donations, and buying practices that increase the amount of fresh and culturally desirable foods at the pantry. SNAP-Ed also recently shared new recipe cards with the pantry and worked with them on some new food displays that give Sonia some ideas for healthy meals. Sonia loves the recipe cards and quickly selects one of the suggested food bundles, which will work really well with the produce that she just received at her doctor's visit today, and with what she has at home in her pantry. Sonia gets home and starts preparing dinner when her children arrive home from school. Both of her kids go to after-school programs. Through work in a youth wellness coalition, SNAP-Ed and other partners engaged parents, students, and teachers to discuss ideas for how to best support these efforts, resulting in a variety of programs benefiting students in the community. Her children's program is part of that local youth wellness coalition, where SNAP-Ed partners with other community programs that combines cooking classes and physical activity from SNAP-Ed with tutoring, leadership development, community service projects, mindfulness, and more from other partners. Sonia doesn't realize all of the ways that her children interact with SNAP-Ed too. Just outside their back door sits a garden kit that her youngest child received a few weeks ago from a Grow Your Own Groceries project that SNAP-Ed had taught at their school. She shows them the produce, prescription vegetables she picked up today and lets her children know that there will be a family event at the gardening happening soon that they can all go to together. Her older child, who's a growing teen, was excited to share that his school has started a share table where students can take unopened cafeteria items from their tray to share with others who are still hungry. Illinois SNAP-Ed assisted the school with setting up the share table, including helping them write a grant to pay for the equipment, sharing policies to ensure food safety, and providing training to school nutrition staff. As a result, Sonia's son was able to grab a second milk and a whole grain cereal bar that would have otherwise gone to waste. That night, Sonia and her 2 children fell asleep, bellies full after a healthy family meal, bodies tired from their activities, and minds optimistic about what tomorrow will bring, because they live in a community working together to make the healthy choice the easy choice. These are just some of the examples of what SNAP-Ed is doing in the community. Traditionally, programs will evaluate one single component of this, say changes to the pantry environment or a nutrition education class, but we strongly believe in our multi-layered, multi-setting, community-driven approaches and sought to find out how these programs collectively and in collaboration with community have an impact on transforming the health of individuals and communities. And so with that, I'm going to hand it over to our friends at Alterum to share more about those results.
Thanks so much, Trinity. If you can go to the next slide. Myself and my colleagues, Brendan and Corey, will be walking through a 4-part evaluation, sharing some of the results of the impact that the Illinois SNAP-Ed program has had. I'll handle the first 2 parts, talking about an overall impact of the program and impact of the social marketing campaign results, and then turn it over to my colleagues for parts 3 and 4. Next slide, please. So first, we'll be talking about how the Illinois SNAP-Ed program has transformed the health of individuals. We completed 2 different evaluations that captured the impact at the individual level. The first is the overall impact, and the second is an evaluation of the social marketing campaign. Next slide, please. To assess the overall impact of the Illinois SNAP-Ed programming, we conducted an online survey that took place at 2 time points with SNAP-eligible Illinois residents. The first survey went out in September 2021 as a baseline, and the second survey was sent to respondents in March 2022. The survey included questions around receiving SNAP-Ed programming, healthy behavior actions, fruit and vegetable consumption, and physical activity. Next slide, please. To determine if survey respondents had received SNAP-Ed programming, we prompted them with questions and pictures of programming that they might have seen in their community, such as photos of program staff out in the community, materials they might have gotten from a program, and online resources they might have used, like the Eat Move Save website, the Find Food Illinois map, or text from the Healthy Text program. Next slide. Overall, we found that the Illinois SNAP-Ed program is reaching its priority and intended audiences. More than 1 in 4 residents living in SNAP-Ed priority communities reported receiving SNAP-Ed. And we saw that some demographic groups were more likely to report receiving SNAP-Ed, like residents who participated in assistance programs were 4.2 times more likely to report receiving SNAP-Ed than their peers who had not participated. Residents who identified as female were 2.5 times more likely. Residents with children were 2.4 times more likely to report receiving SNAP-Ed than their peers who do not have children. Residents who are overweight or obese were 2.1 times more likely. Residents who experienced food insecurity were 1.8 times more likely to report receiving SNAP-Ed than their peers who were not experiencing food insecurity. And residents who identified as Black non-Hispanic were 1.7 times more likely than their peers who identified as white non-Hispanic to report receiving SNAP-Ed. The Illinois SNAP-Ed program specifically focuses on reaching those audiences with programming, and those results demonstrate that their strategies are working. When we take a look at some outcomes that were reported, we found that receiving SNAP-Ed also encouraged actions toward healthy behaviors. Almost 2 out of 3 residents receiving SNAP-Ed took action toward a healthy behavior after interacting with the program. The top responses included both thinking about and starting to be more active and eating more fruits and vegetables, as well as trying new recipes. Next slide, please. We also found that some demographic groups were more likely to report taking action than others after they participated in the programs. Residents who were overweight or obese were 8.4 times more likely to take action, and residents experiencing food insecurity were over 3 times more likely to take action after interacting with the program. Next slide, please. Now we'll talk about the social marketing campaign evaluation. We used a similar method to collect surveys from residents with lower incomes at 2 time points through an online survey. The first survey went out in April and May 2022, and the second survey was sent 6 months later in November 2022. And this survey included similar results as the other evaluation. We asked questions around receiving SNAP-Ed, as well as recall seeing the campaign messages, healthy behavior actions, fruit and vegetable consumption, and physical activity behaviors. Next slide. To determine if survey respondents recalled the campaign messages, again, we prompted them with questions and pictures of the messages that they might have seen in their community. Next slide. And overall, we see that the campaign messages are also reaching our priority and intended audiences. 1 in 5 residents with lower incomes recalled seeing the Eat, Move, Save campaign messages. And again, some demographic groups are more likely to report seeing the campaign than others. Residents who reported receiving SNAP-Ed programming were over 9 times more likely to recall the campaign. Residents with lower educational attainment levels were 2.5 to 4 times more likely to recall seeing messages. Residents who participated in assistance programs overall were 2.7 times more likely to see the messages. And residents who participated specifically in LINK, SNAP, or EBT were 1.8 times more likely to recall the campaign. Lastly, residents who identified as Black or African American were also 1.6 times more likely than their peers who identified as white to report seeing messages. Again, this demonstrates that the Illinois SNAP-Ed social marketing campaign strategies are working as they specifically focus on reaching these audiences with messaging. Next slide, please. We did find that messages are also encouraging healthy eating and physical activity. 2 out of 3 residents with lower incomes reported taking action after seeing the campaign messages. And the most common actions included starting to eat more fruits and vegetables, planning healthy meals, and visiting the Eat, Move, Save website. Next slide. We also know that residents who recalled the campaign messages were more likely to be preparing to eat more fruit, preparing to eat more vegetables, eating vegetables at least 1 time per day at baseline, and to have increased their physical activity from baseline to follow-up. Next slide. In addition to surveying community residents, we also asked Illinois SNAP-Ed community partners for their feedback on the social marketing campaign. And 86% of partners believe that the campaign is reinforcing and supporting their organization's work, which is really exciting. Now I'm going to turn it over to my colleague Brenda to discuss in more detail our work with Illinois SNAP-Ed and their partnerships and coalitions. Brenda?
Great, thank you, Carrie. So we're going to switch gears right now, and I'll provide a very brief overview of how Illinois SNAP-Ed is transforming the health of communities in collaboration with its partners and coalitions. As we heard earlier, Illinois SNAP-Ed works with local partners and coalitions to reach families with a combination of SNAP-Ed activities, as Trinity described. As part of our assessment, community partners and coalitions were evaluated to determine how Illinois SNAP-Ed and community organizations work together to support food access, healthy eating, and active living in their communities. Our assessment consisted of a local partner survey, local partner interviews, and local staff focus groups. Next slide, please. We learned from the partner surveys and interviews that partners collaborate with Illinois SNAP-Ed in a variety of ways. More than 2 out of 3 organizations that we interviewed said they collaborate with SNAP-Ed. They described utilizing SNAP-Ed educational resources, hosting nutrition education and cooking skills classes, creating, implementing, and assessing healthy policies along with Illinois SNAP-Ed, coordinating with Illinois SNAP-Ed to avoid the duplication of services within the community, collaborating with one another on coalitions and communities, and sharing aligned health messages throughout their communities. On the next slide, please. So based on partner interviews and surveys, we also learned about the deep partnership and long-term commitment to joint activities that exist between partner organizations and Illinois SNAP-Ed, as well as a shared purpose and common goals. We heard from many partners who attributed their long-term successes to the reliable and trusted partnership with Illinois SNAP-Ed and the University of Illinois, as well as access to research-based, high-quality resources from Illinois SNAP-Ed that are complementary to the work of the organizations. We see a quote here from an interviewed partner who described that alignment of purpose between their organization and SNAP-Ed. Next slide, please. Another key finding relates to how SNAP-Ed and other community organizations help partner organizations work towards, the community organizations strongly value their partnerships with SNAP-Ed. You can see, as we learned during the partner interviews, by working together towards common goals, both groups are able to expand their reach and make a positive impact within the community. The quote to the right is a great example of the value partner organizations place on their relationship with Illinois SNAP-Ed. The one partner described their relationship with Illinois SNAP-Ed as a perfect partnership. And this sentiment was often echoed by many of the local SNAP-Ed staff that we spoke with, who described strong community partnerships and see SNAP-Ed as a valued part of their community. The next slide, please. Okay, so I'm going to, with that, turn this over to my colleague, Corey Ryan, who is going to discuss the estimated societal and future economic benefits of SNAP-Ed.
Wonderful. Thanks, Brenda and Carrie, for all that great information on program reach and impact. And I'm Corey Ryan, and I'm excited to share today the results on our SNAP-Ed ROI and cost benefit analyses and the work that we've done to measure if the future economic benefits of Illinois SNAP-Ed exceed the upfront programming costs and the cost of administering SNAP-Ed services. So we're going to do that today, and our approach in this work is to calculate the economic benefits that we can measure based on conservative estimates of prevented cases of future obesity and future cases of food insecurity based on SNAP-Ed investments, and then compare that to the cost of providing SNAP-Ed today. And my goal for this presentation is both to provide a good understanding of what the overall results are of the work that we did, and also the underlying methodology that we used in order to estimate these benefits going forward. Next slide, please. So there were 4 steps to this assessment process that we did. The first started with a literature review in which we looked at both literature on estimating the impacts of SNAP-Ed activities, and also literature review around the impacts of obesity and long-term health impacts associated with obesity and food insecurity. There was a process that involved developing actual benefit pathways. So I'm going to show you how we model the long-term impacts of SNAP-Ed programming, and then how we estimate the future impacts and the pathways that we use in order to do that. There was then the third step in then applying data to those pathways that we developed in order to actually estimate the long-term impacts and to incorporate real SNAP-Ed, Illinois SNAP-Ed data into our process based on the number of participants, and then where we applied studies in order to estimate the impact of that SNAP-Ed programming on intermediate outcomes and then long-term health outcomes and economic benefits. And then lastly, with those intermediate health and economic benefits, we then can conduct an economic model where we look over a 5 and a 10-year period to look at what the estimated benefits are from improved health, from improved lifetime earnings, improved educational outcomes, all of the major components of SNAP-Ed programming that we think are impacting long-term change for individuals within the state, and what that means as far as societal savings, and then comparing those societal savings and a cost-benefit analysis to the upfront cost of providing the programming. Next slide. So before I get into describing the results, and we're very excited to share those, I first want to give a sense of how we go about actually modeling the impact of SNAP-Ed, because it's very difficult for us to track directly long-term health and earnings outcomes from those that are participating in SNAP-Ed today. We know that SNAP-Ed is having an impact on changing today's behaviors among those that are participating and receiving the services. We know that those changes in behaviors today are likely to have an impact on long-term health statuses, reductions in obesity, lower chronic disease risk, improve overall health, lower rates of food insecurity. We know that those are really positive changes that are likely to occur from the SNAP-Ed behavior changes that are driving those impacts. But we're not able to measure those directly because we would have to track SNAP-Ed participants over a long period of time. And that is both very costly and programmatically very difficult to do. So instead, what we do in this work is that we estimate long-term impacts indirectly. And so we look at where we can see actual behavior change occurring, and then using those changes in behaviors based on really high quality academic studies that have looked at the link between programming and behavior change and long-term health, to then incorporate those long-term health and education and earnings outcomes into long-term economic benefits. And so you can see on the right, the way that we model through these pathways in general. And then what I'm going to do today is then show you kind of specifically for each of the SNAP-Ed program components, how we incorporate the academic research and how we identify the individual metrics that we use to estimate the long-term benefits. So what we're doing in this work is really trying to take the information that we have that's available to us on the change that we can see in the SNAP-Ed population today, and then measure what we think that impact is going to have as far as long-term changes in health and long-term economic outcomes. This work can also be supported in the future by work that is actually looking to track those changes over longer periods of time. But as I've mentioned, that is both kind of costly and administratively difficult, such that we were not able to do that in this work. So we use this indirect modeling approach instead. Go ahead to the next slide. So let's take the first pathway that we look at when we're trying to measure long-term economic impacts. And we begin in the top left there, where we look at SNAP-Ed participants, and we look at those that were partaking in programming that was predicted to have an impact on improving diet quality. And then we say, okay, based on that programming, let's look at evidence of what impact that type of direct education, social marketing, indirect education programming is likely to have on improving healthy eating habits. And as Carrie showed, we saw significant changes and improvements in that type of behavior among SNAP-Ed participants. And we estimate improved healthy eating habits based on fruit and vegetable consumption per day. Once we know and we have a prediction of what we think that the impact of SNAP-Ed is going to have on fruit and veggie consumption, we can predict how that healthy behavior change is going to improve long-term health. And we estimate that long-term health based on a reduced prevalence of obesity as a result of that increased fruit and vegetable consumption. What we do in the modeling, and you'll notice this in the other pathways that I show, is that we focus on very particular health impacts and economic impacts as kind of key indicators of improvement in health and economic outcomes. We know that consuming more fruits and vegetables are likely to have a broad range of benefits for both diet and health across a variety of different healthcare conditions and economic outcomes. What we use, for example, in this case, is the prevalence of obesity as a key indicator and the main point in which we estimate how much we think the long-term health improvements are going to mean from an from a total economic benefit standpoint. If we included multiple types of improvements in health, which we know SNAP-Ed benefits are likely to cause, there would be a risk of double counting. There would be a risk of counting both the benefits of decreased cardiovascular disease alongside benefits of obesity, because we know that those impacts overlap when it comes to monitoring healthcare spending. So we only measure one key metric for each of these pathways as far as improvements in long-term health. And then we take that improvement in long-term health, and then we estimate the future economic impacts, the dollar amounts that we expect to be saved and recouped for society as a result of those improvements. And so once we've estimated the number of individuals that have a prevented case of obesity as a result of SNAP-Ed programming, we then estimate how that impacts future healthcare spending, because if you are not obese, you are likely to have lower healthcare spending in the future. That benefits both households and individuals directly because they have lower healthcare costs. It also provides savings for federal and state governments from savings in Medicare and Medicaid among those that are publicly insured. So we take those improvements and then we measure the future economic benefits through that pathway along healthcare. We also know that when it comes to obesity, reducing obesity also has benefits in education and earnings, and reducing obesity has the potential to increase future earnings of individuals. Those that are not obese, for example, miss fewer days of work, so there are lower rates of absenteeism and presenteeism, and that increases future economic earnings for individuals that have that prevented case of obesity. That results both in, again, benefits for the individual in that they would have increased take-home pay, also that they would have increased future tax revenues because those greater earnings are associated with greater future tax revenues. So we're using that proxy long-term health outcomes, that reduced case of obesity that we predict is occurring from SNAP-Ed participation, and then measuring the long-term economic impacts that we believe that that's going to have. I will note that this pathway does not incorporate all the benefits of SNAP-Ed participation. As Carrie and Jen and other folks have been talking about, there's a very wide range of impacts that we expect SNAP-Ed program to have in improving both the quality of life and the long-term outcomes of those that are receiving these benefits. However, what we're doing in this work is trying to use the best available literature and the best available indicators for long-term change that we can measure in the data to predict long-term outcomes. So these are arguably very conservative estimates, and that we're only looking at very specific impacts of particular pathways for improving the outcomes for individuals receiving SNAP-Ed. Go ahead and go to the next slide, and I'll show you the pathway for physical activity. And so this again looks similar in that we're starting with SNAP-Ed participation, and we're then using that participation to predict how those that receive particular programming activities related to physical activity would increase the number of days per week that individuals had exercise. That again is going to impact long-term rates of obesity and follows through the exact same pathway, and that we predict those reduced cases would decrease future healthcare spending and increase future lifetime earnings. So what we're doing in this pathway is just looking at a different type of programming and a different effect size, a different impact on physical activity that leads to lower rates of obesity. And then the downstream impacts of obesity are the same in the way that they're measured in the modeling. Go ahead to the next slide. The last category that we look at is the impacts of SNAP-Ed on food insecurity. And so this is looking at SNAP-Ed programming that is targeted towards allowing families to better manage their food resources and to better spend their food budgets such that they are less likely to report rates of food insecurity or hunger. And we modeled this pathway through different components because based on the literature, there are different impacts of food insecurity on children versus on adults. For children, the strongest known impact of rates of food insecurity is impact on educational outcomes. And when we look at impact of educational outcomes, we proxy that through looking at graduation rates, and then look at the impact that is likely to occur by reducing rates of food insecurity among children and young adults in how that would impact their graduation rates, and then how those graduation rates would impact future lifetime earnings, again, impacting future take-home pay and future tax revenues for state and local and federal governments. Separately, if you go to the next slide, we'll show you then how that also impacts adults. So lower rates of food insecurity have also been shown in recent studies to improve health and actually decrease future healthcare spending. This decreased future healthcare spending has not yet been seen among children. It likely does occur. It just hasn't been shown in studies that we've been able to incorporate into this work so far. So we limit the food insecurity pathway through health for adults to only the adult population. And so for adults, improved health, again, similar to what we've shown before, is likely to feed through in savings as a result of healthcare savings, healthcare cost savings for adults that are kept by the households, and then also savings for government as a result of lower Medicare and Medicaid spending. So these are the three major pathways when we look at the impact of SNAP-Ed programming. And now what we need to do is I need to show how we incorporated data as far as the magnitude of the impacts that occurred here. So these are the links that we show to kind of go from SNAP-Ed participation to long-term economic outcomes. And then the next step in the process, if you go to the next slide, is how we collect the data in order to predict how large we think those impacts are, how many individuals were impacted, and what the impact on obesity rates and food insecurity rates were, and then how we monetize that into future economic benefits. So that first step on the left there, we started with using SNAP-Ed program data, where we looked at the number of individuals within Illinois SNAP-Ed within a single year that received direct education, indirect education, PSE services, and also social marketing campaigns. And so among those four categories, we then, through the pathways, impacted how each individual within that within those four programs would have had a lower risk of obesity and a lower risk of food insecurity. So we look at the rates of obesity and food insecurity in Illinois, and then we use a wide variety of studies across different categories to estimate how those obesity rates would go down in the future as a result of SNAP-Ed programming relative to a case where SNAP-Ed programming did not exist. So this is a study that is basically saying, what are the benefits of SNAP-Ed based on the fact that SNAP-Ed programming is occurring within the state today relative to what the outcomes would be if SNAP-Ed programming was not there? And so that's the counterfactual, is if SNAP-Ed programming was not available. And so what we predict is that obesity rates are lower, future obesity rates are lower, and future food insecurity rates are lower as a result of SNAP-Ed. Once we know how those rates have been reduced, we then use an economic model to predict how those lower rates impact future healthcare costs, impact future mortality, rates of insurance. We incorporate data on economic outcomes within the state and have a wide variety of other economic assumptions to then get to our final number, where we're estimating what the total impact is of SNAP-Ed programming in a single year. And on the next slide, we show our key finding, and that is that Illinois SNAP-Ed returns future societal benefits in a range between $76 million and $135 million in a single year. So when I say in a single year, what that means is that we're looking at a single year population of individuals that received or were impacted by SNAP-Ed programming within the state. So we're taking everybody within a single year that received either direct ed, indirect ed, social marketing campaigns, or PSE, and then we're able to measure what the impact was over a 5-year and a 10-year benefit horizon of what the impact was of the fact that they had likely lower rates of obesity and lower rates of food insecurity. So that's where the range of this number comes from, is that there's uncertainty in our modeling of how long these benefits will persist for this population. So we know the population that's going to be impacted. We know that we're going to likely, as a result of changing their healthy behaviors, have an impact on their obesity and food insecurity rates. We know, unfortunately, also that those benefits are likely not permanent. There's a large set of literature that knows that changes in healthy behaviors and diet are likely to not be persistent for the rest of an individual's lifetime. And so what we do in this work is that we estimate how long we think that those obesity and food insecurity reductions are going to occur, and then monetize only the impacts on health throughout that period. And so the $76 million estimate is estimating the benefits over a 5-year benefit horizon, and the $135 million is estimating over a 10-year benefit horizon. And you'll see this kind of range of estimates in a variety of the outcomes that I report here. Go ahead to the next slide. So when we break down those benefits across the two major categories, we see that the benefits incorporating healthcare cost savings range between $35 million and $65 million among SNAP-Ed participants. And then separately, the increased education, life expectancy, and lifetime earnings impacts are slightly greater, $40 million to $69 million, but relatively evenly split across these two major types of impacts that are occurring for the SNAP-Ed population. Go ahead to the next slide. And so then when we take these total benefits and then we compare those total benefits to the upfront cost of providing that programming in a single year, we see that SNAP-Ed returns between $5.36 and $9.54 per dollar spent in future economic benefits. So this is comparing the total societal benefits, the impact on both the participants, governments, businesses, the private sector within the state relative to the upfront cost of providing those dollars. So this economic return is very significant, but the benefits are very diffuse. So the benefits are occurring to a wide range of individuals. It's somewhat hard to capture those benefits, but those are benefits that are occurring to the entire set of society. And when we specifically look at the benefits to the federal government, SNAP-Ed returns nearly $24 million in gross benefits based on the single year of SNAP-Ed programming. Go ahead to the next slide, and we'll show the breakdown of these benefits across a couple different categories. You can see here on the left, the split in the benefits that are retained by the private sector, by households in the private sector, are the greatest, followed up by benefits that occur to the federal government. The primary source of those benefits to the federal government are coming from both increased tax revenues and also from decreased future healthcare costs. And then what's left at the bottom is also benefits to state and local governments, again, coming from increased future tax revenues and also decreased costs in Medicaid. On the right, you can see the split in the total benefits occurring from health versus those coming from lifetime earnings. And in both of these charts, you can see two separate bars. The first bar on the right is showing those benefits where we only assume a 5-year benefit window. So we assume that after 5 years, those health outcomes kind of revert back to the mean, and you assume that individuals no longer have those changes in obesity and food insecurity, versus the 10-year benefit window that assumes that the behavior change occurring from SNAP-Ed occurs over a longer period of time. This is an current unknown in the modeling, which is why we show the results across a wide range of impacts. We think this is a plausible range to assume. I think future research within this space could further bolster a better understanding of how long these benefits are likely to persist and how long these health outcomes are likely to occur for individuals receiving SNAP-Ed and similar types of programming. Go ahead to the next slide. Here you can see the split in the benefits based on where they're occurring based on program activities. So you can see all 4 of these program activities are resulting in significant future economic benefits for Illinois residents, both coming from social marketing, from policy and PSE activities, from direct education programming and indirect education programming. The total impact that you're seeing here is dependent both on the relative size of behavior change that we think each of these individual activities are causing, and also the number of individuals impacted by each of these activities. So actually the biggest driver and the reason why social marketing is the largest number here is because it's reaching the most people within the state. The relative size and the benefit per interaction is likely much lower, but it's reaching a far greater population of individuals. And again, there are a lot of assumptions that kind of sit behind how we assume the magnitude of those relative impacts. I think there's future work that can be done in that space, but our modeling right now is estimating what we think the size of those impacts are for the number of individuals that are impacted. Go ahead to the next slide. Lastly, you can see here how the benefits are divvied up among the different types of programming. So programming targeted at diet and nutrition versus programming targeted at food resource management versus targeted at exercise and physical activity. You can see diet is making up the largest component here. That makes sense because the vast majority of a lot of the SNAP-Ed programming that we're looking to measure the impacts of is coming from the diet pool. So it's really the greatest number of individuals that are receiving this type of programming that is causing the diet impacts to have the greatest long-term economic benefits. Those benefits, again, are occurring as a result of reductions in obesity, improving diet, improving long-term health, and then generating future economic savings. Go to the next slide, and I'll just talk a little bit about some limitations and some opportunities to improve this modeling going forward. So we were able to use actual data from Illinois SNAP-Ed to estimate the program size, the number of participants, and what type of programming they received. So both whether or not they received diet programming versus exercise programming versus food resource management programming, and whether or not it was in the direct ed versus indirect ed versus PSE format. That data we had directly from Illinois SNAP-Ed. But estimate on the impact on behavior change and those impacts on behavior change on future health outcomes come from the literature. So right now we're looking at the population of SNAP-Ed and then using very similar studies that have been done of similar programming to estimate the impact that we think that has on long-term health. I think there's a space to certainly do more direct tracking of SNAP-Ed participants within the state. to more precisely estimate how much we think the health outcomes are actually changing by actually tracking that among individuals over a long period of time. As I said, that's difficult and can be expensive, but it definitely would improve our estimates rather than using the literature to estimate the size of that impact, to actually look at that impact directly occurring within SNAP-Ed participants. And I'll particularly note where looking at particular program outcomes, specifically for PSE activities and indirect education, we don't have direct studies that were able to predict how those particular types of programming impacted behavior change and long-term health relative to the direct ed programming that's been more rigorously studied in the literature to date. So what we did is we assumed a relative effectiveness of these programmings, assuming they were slightly less effective per person on the behavior change and future health outcomes relative to the direct ed. And I think these are plausible estimates, and I think they could be improved in the future by, again, more precisely tracking these outcomes for individuals over time. And so these are just, I think, some opportunities and might potentially warrant future investigation in both future studies within Illinois and also among SNAP-Ed and similar programming more broadly. And you go to the last slide, I just summarized the key findings that we have here, that SNAP-Ed was able to generate significant total future economic benefits. They range between $76 and $135 million. These benefits come from both healthcare cost savings and also improvements in future lifetime earnings. And when compared to the cost, we show that SNAP-Ed programming likely returned between $5 and $9 per dollar spent and produces significant benefits for the federal government going into the future. So this work is still ongoing. We're going to present this work at some conferences. We're going to publish some peer-reviewed literature in this work. And so lots more details to come as we further kind of present and refine this work going forward, but was very excited to be able to share everything that we've done to date so far.
Thanks so much, all of our colleagues from Alterum and for Trinity for taking us through a little bit of background on SNAP-Ed. We have started to receive some questions in the chat or in the Q&A module. So if you want to ask any questions, feel free to put them in there. While you're typing your questions, I'm going to turn it over to Melanie Kluzak to give us a few highlights of what is happening next in SNAP-Ed while you type in those questions. So go ahead, Melanie.
Thank you, Jennifer. So, wow, that was just a ton of information. And I want to say thank you to everyone as well from Alterum and the University of Illinois. It's a lot of information. So now that you've listened to the results of our evaluation and have a better understanding of Illinois SNAP-Ed's impact in Illinois, we as the state agency would like to ask for your help in addressing the next steps for our state. So we would like to turn our focus now to our upcoming federal fiscal year 24 state plan and our needs assessment process. And we will be taking on more of a leadership role in conducting this part of our state plan with a focus on equity in coordination and partnership with the University of Illinois. And some of the things that are going to be making up our needs assessment in Illinois that we're looking at existing current primary data, population and program data sources, information collected from working with organizations and people that influence or are influenced by the SNAP-Ed program through focus groups and listening sessions. And then current Illinois SNAP program participant data. We have worked with our team here at DHS to be able to pull this data from our current SNAP participants to identify and target minority populations to be able to map our current programming and what our reach is, and then be able to better understand kind of where we need to go from here to make sure that we're meeting the needs of our minority groups and those facing food insecurity. And then for the purpose of today, our ask is we have a survey, Bindi Lessing, she's on the call as well. She worked very hard on putting the survey together. And so we would like to survey our current SNAP Ed partners as well as our potential SNAP education partners in Illinois. We would ask that if you're joining from another state or you're currently a SNAP education worker attending this webinar, that you do not participate in the survey. And we also will put the survey in the chat as well. And so we just want to say that your feedback is vital to us to be able to collect this information and kind of determine our next steps for Illinois and what the priorities should be over the next 3 years. I just want to say that this is a very, very, very short survey. Should take you less than probably 3 minutes, maybe even 2 minutes. It's one question, and it is live, and it will close a week from today on Wednesday, May 24th. So thank you, Trinity. This is our QR code. You're welcome to scan this with your phone, or you can, like Jennifer had already mentioned, everyone will get a copy of the slides, the slide deck presentation for today if they have not already. And so you'll have this link, and then there'll also be a recording as well. And then for those that maybe were not able to attend today, we will send out a follow-up and provide the link as well as in the chat today. So that is all I have. Thank you very much.
Thank you, Melanie. So we have several questions in the chat. I have several of these answered live because they kind of hang together. And so the first question is for you, Corey. There are several questions on whether we use behavior change data from program participants in Illinois. So I know that it was in your presentation a little bit, but could you talk briefly, very briefly, about the link between our actual behavior change data and to these estimates?
Yeah, so we did not use behavior change data directly from the data that was collected in Illinois. And the reason why we didn't do that is because studies that have been done of, for example, direct ed programming that we were able to pull from the literature did a better job of actually looking at reporting outcomes and behaviors both pre and post directly following the direct education programming. And so that provided the best possible estimate, we thought, of looking at actually the magnitude of the change that we think occurs as a result of the SNAP Ed programming directly. What was taken from the participants in Illinois that Carrie and Brenda talked about was a wider range of behavior change across a wide variety of participants that didn't have that direct kind of pre-post of those that right before they started and then right after that programming ended. So that's why we use the literature for those estimates and not directly data from Illinois participants. I think that's something that could be sought to be collected in the future and certainly would improve the kind of specificness of the estimates to the Illinois population.
Thanks, Corey. Another question, I'll take this one. Do we have any current or future plans in place to track a cohort of SNAP Ed participants over time to refine the estimates in your ROI? We do not. The amount of funding that we have for that would not, we do not have enough to do that type of study. Also, some of the longitudinal studies that we have done up to 15 months have been very difficult to keep track of people. People drop out of the studies, as you can imagine. So the studies that do follow people longitudinally for a long time do involve quite a bit of expense to keep people engaged, and SNAP Ed does not have that amount of funding. Excuse me. Some other questions. I know we're getting to the top of the hour, and so I will take one more question. One of the questions was asking how the program impacts food insecurity in these communities. Knowledge is power, but food deserts still exist. Yes, so SNAP Ed in Illinois addresses food insecurity through our policy systems and environmental work with organizations. And so Trinity talked about some of the examples that we work on in terms of food access. And so a lot of community coalitions partner with SNAP-Ed to look at gardening programs. We most recently worked with a coalition down in Southern Illinois in Cairo, and we're excited that their grocery store in Cairo is opening on June 16th. Excuse me. And so those are just some of the examples of the work that SNAP-Ed is doing in communities to address those food deserts. We would be happy to share many more, but I see that we are on the top of the hour. So on behalf of Illinois DHS, the University of Illinois Extension, and the University of Illinois Chicago Partnership for Health Promotion, we thank you for joining us. As I mentioned, and you may have saw this in the Q&A, all registered attendees will receive a copy of the webinar. And Caitlin just put in the chat our one-page impact report. So if you would like to download a copy of that, you can feel free to share that broadly and keep that in your files for your own use. And I would be remiss if I didn't thank Caitlin Kawanaki. She was the woman behind the scenes, our lead evaluator for this project, and it wouldn't have been possible without her. So thank you, Caitlin, for bringing this vision to life and all the work that you have done in this project. So again, thank you for joining us. And we apologize if we didn't get to all of the questions. Feel free to reach out to us if you have questions about Illinois SNAP-Ed. You can contact myself or Trinity Allison. And then any of the results shared, again, Caitlin Kawanaki or Corey Ryan would be your best expert in terms of the return on investment questions. So thank you again. I hope you have a good rest of your day.